So I work for Community Health Network based out of Indianapolis, Indiana. We're multi-hospital and multi-practice sites when it comes to primary care and specialty care locations throughout the Indianapolis area. I'm the director of Ambulatory Access Solutions. So when it comes to patient access, and what I'm charged with at Community is just really the ease of getting the patients and the people in within our communities to the care they need, really looking at the right care, the right time, in the right place. So we have a centralized contact center team, and what they do is they take our large list of 600 odd providers, and we are empowered to directly book with those physicians based upon the patient's needs, their preferences, and we directly book into our electronic medical record system, Epic. And I was actually hired on to centralize that group. Historically, all scheduling was done locally within the practices, but there's a lot of opportunity there just because our practices have variable hours of operation. Our practices are limited to really just booking for their individual doctor. So let's say if a provider, as soon as they can get a patient in, is in 3 months, what we have the ability to do is scour across all our providers and find that first available appointment that's to meet the patient's needs. And so we realized there was opportunity to centralize. And so what we first started with was new patient scheduling. So that's our niche, I guess you can say, is that we focus on getting new patients into Community Health Network, breaking down some of those common barriers so they can get access to the care that they need. And we worked with each specialty one by one till we got to the point where 100% of our specialties were also could be scheduled within the contact center team that we have at Community. Since we implemented ProviderMatch Access Center, PMAC, which was December of last year, we've seen a 20% increase in efficiencies within the team. But also we have seen the increase in, again, number of completed appointments, which in turn means a decrease in cancellation and no-shows. So our physicians are extremely excited about that fact that we're matching them up with the patients they want to see and the patients they should be seeing so they can work at the top of their licensure. And then thirdly, the most important is patient satisfier. Patients are the ones that end recipient all because when they call, they're confident we're going to book them with the most appropriate provider the very first time. There's no back and forth when it comes to rescheduling or cancellation of no-shows. Basically, service level, just a level set, is what percentage of our calls are answered within X seconds. And so we have a pretty high standard of Community that 90% of our calls are answered within 30 seconds or less, because that's, again, when it ties it back to patient experience, that's a huge satisfier. If you can quickly answer that phone when somebody calls in and give them exactly what they need. I know our marketing team has been doing a lot of research on how we can redesign our website and just provide a better patient experience when it comes to our online experience. And so some of the things they definitely were exploring was just the look and feel of our website. Are we providing the information and the tools and resources that patients even want? As we were working in concert with the referral center, we identified that there were some opportunities for improvement on our online experience, as I like to call it. And so that's why looking at solutions such as ProviderMatch, it was a win-win because I know our marketing team is already looking for a solution, and to identify something that we could now make consumer-facing and ProviderMatch consumer, it was a win obviously for my group in the patient access area, but also for the marketing team because I know they already were in the journey, if you will, to find something a little bit better when it comes to the patient experience online. As we know, especially with the generations that we have now that are seeking health care, they want convenience. They want to be able to be empowered to be able to book directly at their fingertips. So direct online booking is something that I know that's extremely important to us and something we want to discover more when it comes to one of our key initiatives moving forward. That's the most exciting thing about working for this organization. And I think the most exciting thing about Community Health Network is that we have more than anything else a patient-first mentality that will go above and beyond to give the care that patient needs and deserves.